Hi students, I am do your first chart with you. It's going to be the basic, which you do have the answers. So here are the answers here, but I am going to kind of go through the chart itself. So let's go ahead and start here. The first page is the discharge summary. One thing to keep in mind, yes, I know these are from 2008, but they are still very good charts. They're nice charts for students to learn from. We have these from AHEMA. So let's start off here with principal diagnosis causing admission. So the wound is oozing, it's open. Let's look, here's what you need to do. Okay, so we know that it's 2008, okay, and we know that the patient was in 626 to 630. Okay, so really pay attention to some of these dates. I think that'll help because here we had a cough back in 2007. All right, so keep that in mind. It was resolved back in February of '08. Pulmonary embolism, this was back in 2008. We have an infarcted bowel, that's '07. They're on warfarin, so they're on a blood thinner. And they do have a history of atrial fib. So let's go down here. It was resolved. They have sleep apnea. They use a CPAP. They had benign neoplasm of the colon. Okay, this wasn't too long ago, 6/3/2008. Adenoma times 2 from the colostomy takedown. That was in May of '08. History of respiratory failure, okay, 6/27/08. So that's right in our admission. Okay, so we go to that. Let's go here. Unable to wean from vent post-op, '07. They needed a trach, again, '07. '08, respiratory systems have resolved. Right here, this is this admission. We have the wound seroma. They're admitted 6/25 with increasing wound drainage, and they had an abdominal lump. So here the CAT scan shows a likely seroma. They are an MR, they're a MRSA carrier. They do have anemia. So let's look here. We have a wound culture with MRSA, CT abdomen pelvis, IV oral contrast. This just talks about the seroma itself. So they are improving. No discharge medications. Okay, here we talk about the brief hospital course. So I always read through, basically I read through the whole chart. I always start usually with the discharge summary. I like to read the H&P. I go into the doctor's notes, the orders, to see if they ordered anything, any medications, all of that. Procedures performed. They did do a wound vac. There was no complications. Okay, there's no pending test results. So here's the history of present illness. Okay, so always read through that. It could give you a little bit more. Here's our active problem list, which we talked about up above. Medical history, they did have pneumonia at one time. Keep in mind, just because they had pneumonia, this is their medical history. If it's resolved, you're not going to code any of this. You're not going to code the closed fracture clavicle. You want to code things that are going to make a difference on this admission. Okay, so keep that in mind. Just giving you a lot of information here. Okay, so we go through review of systems, their physical exam. So once again, make sure you read through the chart. Okay, so what I'm going to do, I'm going to pull up the answers here. So remember, I see a T code. So first indication that T code is telling me there's a complication, right? So I'm going to pull up. It's going to be my wound. I have T81. Okay, I'm back. I had to go out and clear everything out again because I got timed out of 3M. So, excuse me, for the first code, you want T81.31. Okay, so keep in mind I went to complication surgical procedure, and it's going to be the fistula, the persistent post-operative is one way to find it. You can find it other different ways too. So with that, I'm going to click on, and it's going to be XA, initial encounter. So that is going to be my first code. All right. So then here, I'm going to just have you check it out. So let's go to the two different codes, and you can decide from documentation. So I've got K91.840. It's going to be post-procedural hemorrhage of digestive system organ following a digestive system procedure, or if it should be K94.02, which is a colostomy infection. So I'm going to have you determine that. All right, so then we get into just our secondary diagnosis codes. So let's go ahead and go through them and see what we actually need. The first one, okay, the patient is obese, so we have a body mass index. So I should have an obese code here along with that E66.9. That's going to be my obesity code. So those two go together because this could make a difference in this admission. So again, you always want to look at what's going to make a difference in this admission. Okay, so then we have G47.33. That's going to be the sleep apnea I talked about. Okay, they do use a CPAP, so they are treating it. Right, and then we have F51.9. Okay, that is our sleep disorder. We're going to go, we have two Z codes here. So you can see a lot of those things that we're not coding, even though it was their past history. Again, you want to code what's pertinent to this admission. So we have Z22.322. This is our MRSA, okay, carrier of infection, MRSA. We also have long-term use of anticoagulants. They're on warfarin. Okay, so with all this, I did code everything, okay? And my MSDRG is going to be 920. So with that, intermediate chart, just to help you out, you will have 6 regular codes, 5 Z codes, no procedures. If you need help with the first code, you look in the discharge summary for this code. I kind of put down where everything is. So, spelled wrong. So this should help you out. Once again, I'm just trying to make it a little bit easier on, starting chart coding. So please let me know. Hopefully this video helps if you have any questions or concerns.